Hi, James.
Hello.
Question for you is, what health challenges do elderly people face in terms of health and well-being?
Okay.
Yeah. Um, so ignore the bullet point.
Okay.
That's the question there. What
Yeah.
health challenges do elderly people face in terms of health and well-being?
Okay. So what health challenges do elderly people face in terms of health and well-being? Well, initially, I'd like to sort of touch on the point of sort of mental health in the elderly. I mean, the prevalence of depression is massive in the elderly. That can be due to loneliness and reduced contact with family. Maybe that be due to just lower physical health, so they might not be able to leave the house, reduced mobility. So they might not be able to do the things that they enjoy, their hobbies. So that can often cause low mood and depression. Maybe being isolated from their family and friends. They can't go to people about their issues. So I'd say that's also it makes it difficult. So that can actually exacerbate health inequalities with them struggling to reach the health care that they need. They aren't able to sort of get their health checked and treated as much because they're struggling to reach appointments at the GP or at the hospital. So that often increases health inequalities. I'd also like to touch on maybe sort of the prevalence of delirium that the elderly go through and frailty. So, for example, if an elderly person has a fall and ends up in hospital, that could often lead to sort of delirium, and then so it's important that doctors are able to communicate effectively with not only the patient to establish sort of a baseline level of understanding, but also family members. And that's another thing that sort of elderly people can face, is that sort of delirium, and how can doctors sort of effectively treat that and try and get it back to those baseline levels of understanding. And once they sort of essentially go into the sort of spiral of being unwell and being poorly in hospital, it's often difficult to recover, which is sort of why I touched on frailty.
Sure.
The difficulty to recover from conditions and falls and things like that. So it's definitely important that doctors have the right sort of post sort of hospital planning in place. So sort of plans for the next step. So if they have to ever come back into hospital, would they have how frail are they? So they do the Rockwood frailty scale and things like that. Assess whether they want to put a DNAR in place or things like that. So it's important that we have these procedures in place to support elderly people through their health, not only whether that be mental. So as I mentioned before, at home, maybe they're feeling lonely, they don't get the support they need, or potentially while in hospital as well. So sort of delirium and also their ability to recover from conditions and falls and things like that, and operative. So you need to look at maybe whether you'd do invasive surgery or potentially not bother and look at more non-invasive, looking at making patients comfortable, and palliative care. So it's important to explore all options and really tailor the care for each specific patient based on sort of maybe their frailty levels and what their patient actually wants themselves. So they have autonomy over their care and they have the consent to make those decisions themselves.
So you mentioned a few things there. I think it's fair to say elderly people, they're probably a section of our community that's hardly reached. What do we mean by hardly reached community?
So I think I touched on it a little bit before when I mentioned sort of the health inequalities that come around with elderly people. So you could say that they're hardly reached because it's difficult for doctors to actually see these patients. So many of them will never sort of be contacted with a doctor, with a GP, unless they sort of have those strong family links in place or family and friend links in place who'll be able to take them to appointments and things like that. So with reduced mobility comes reduced sort of contact with doctors and and healthcare communities. So it's important that doctors are able to stay in contact with these patients, whether that be through online consultations, or potentially if the NHS could possibly fund even more sort of home visits, because that could be incredibly important, especially in the future with the aging population. You know, the ability for doctors and nurses to be able to get to patients' homes and treat them there and look after them from their homes would be extremely beneficial, because, you know, in terms of the reduced mobility, that can have an extreme effect on whether they can reach their appointments and or not.
Sure. Yeah. Okay. Thank you. Yeah. So how do you think you did there? How do you think?
I think I was quite happy with my answer. I think I went into quite a bit of detail in some points, which I was quite happy about. But also, at times I feel like I waffled on a little bit. I feel I could have reached some different areas which I didn't quite cover. Potentially, sort of looking at maybe going into a bit more about the family of these patients and how we could use them to sort of help us support them, and really actually address the question maybe a little bit more, sort of like what other health challenges might they have, such as like, I don't know, osteoporosis. If you go into specific conditions, potentially that does come under the bracket of frailty, but maybe you'd think about like arthritis and the different sort of issues that, you know, heart problems, just everything that comes with, you know, old age, rather than just focusing on that frailty. But
no, you're absolutely right. The we covered you covered mental health, increased risk of depression, loneliness, lack of contact, loss of mobility, increased health inequality because they're not being able to access health checks, they can't see their doctors and hospitals as easily, frailty, falls, delirium, difficult to communicate, don't recover as well. You showed some insight about Rockwood and DNAR.
You got a lot of it was insane. Honestly, you really did well.
You know, I think you should start to pat yourselves on the back now. This is the level of answer we need. Yes, you can go on. You can talk about, as you rightly mentioned towards the end, that I could have mentioned about somebody's ongoing illness, for example. Let's say it's a heart patient. As they get older, they can't access the cardiologist as easily. More can go wrong with the heart. More can go wrong with intervention. You know, do you know that tablets and medication can cause problems, iatrogenic problems, we call them. So even the condition that they've had for the last 20 odd years starts to become an issue because we're either not treating it well, or we're overdoing it, or we're underdoing it. The needs change. It's
impossible to know as well, isn't it? So without them being able to come into their cardiology consultations, then it's impossible for the doctors to sort of address their.
Absolutely.
And it just sort of spirals, won't it? As it gets worse, and it's not getting treated.
Exactly.
The next time they go in, they're going to be really, really poorly, and it's already too late to sort of do anything. That's why it's really important that I think we're able to sort of push this agenda of making sure that these people are getting the appointments that they need, especially ones with existing health conditions.
Sure.
Like maybe whether that be through home consultations or Zoom.
So
just using the resources that we have.
Yeah, absolutely. So in terms of well-being, in the original question, health and well-being, you could cast your net a bit wider and kind of think, well, actually, as well as the health implications, there's also implications around money. There can be a lot of poverty amongst elderly people because if they're relying on state pension, for example, the UK is not well known for a good pension, is it?
No. Relying on their children to facilitate them.
Needs. Absolutely.
They must feel guilt as well.
100%.
For their children who are having to wait for them. Yes. Maybe even wait for them to actually diminish. To
Absolutely.
The point where they're actually going to die in palliative care. So I can see where mental health can come in there.
Yeah, and just definitely sort of the mental health associated with becoming old and sort of having these health issues. Obviously, can be quite depressing as well, can't it? I mean,
it is.
No one wants to be poorly, no one wants to be ill. So actually having to deal with having these conditions day in, day out, being in these palliative care sort of.
Yeah.
You don't want to have to be looked after, do you? I mean, it's a nice thing that they're able to give that support sometimes in a care home or in other settings, but no one wants to have to rely on others to live their life, do they?
No.
You kind of lose your identity, don't you?
Yeah, you lose your sort of your dignity.
Your dignity, yeah.
So, So when they talk about things like words like well-being, always think on a wider footing. It's health, but also it's all about being, i.e., money affects you, your dwelling affects you, right? What's the quality of your home like? So elderly people tend to have colder homes because they're thinking about the bills. Heating it's expensive. Elderly people, by and large, will live in homes that aren't as well insulated.
Because they don't want to move out and things like that, especially they live in older homes and stuff like that.
Absolutely. Or elderly people tend to live in areas that aren't necessarily accessible by everybody in the community. So they may be in a care home, they may be in elderly people bungalows, those kind of environments, or apartments, and so they kind of become almost cocooned away from the rest of society. In the UK, you'll find that in contrast to countries like Germany and places, we don't design our towns well. There probably won't be as much green space around those homes. They probably won't have a bus route close to them homes. They probably won't have.
I really think that the UK has a real big issue with the way that we deal with, and I'm not just saying this is just I feel like a lot of the time older people are sort of tossed aside. I know in other cultures, it's really important that you look after your elders, and they're sort of integrated as part of the family. You've
read that book, haven't you?
Which book?
Being Mortal.
No, I haven't read it. No,
it's literally about what you're talking about.
So in other cultures, they'll sort of integrate the elderly into their homes, and they'll sort of look after them, and that's really important in their cultures that's done. And I think in our country, that's in our culture as well. Sometimes that is sort of not addressed at all, and you sort of say, just if they can't look after themselves, rather than we looking after you, we're just going to sort of put you in a home, and then that's that. I mean, I think it's a very sad reality of what it is.
Yeah.
But I feel like we have a real issue with that.
Yeah.
So that can be another root cause of the depression and the loneliness that comes with it.
Absolutely. Absolutely. So what do we mean by hardly reached communities? Elderly people are one of those communities that we don't reach out to, as much. There's other hardly reached communities like BAME communities, like deprived communities, like places where there's more widening participation issues. So, for example, widening participation isn't just a deprived community that can't access education or healthcare. It's also about, remember you mentioned about online access, remote access. Well, elderly people, either they might not have the knowledge
the technology,
or they might have a tab there, but they haven't got the fingers to do it.
Or can't even afford the technology as well.
Yeah, absolutely. We call it widening digital.
It's not that actual accessibility. It's not actually that accessible for older people.
No.
In some cases, is it?
No, absolutely.
Unless they have proper training, and often if they've got dementia and other sort of difficulties that come with later life, it's probably quite difficult to actually teach them how to use these things.
Absolutely.
Set in the ways and things like that.
Would you recommend to try to list a lot of different scenarios and situations and tick off a lot of points? Or would you rather recommend the points you mentioned, delve into them, go into them deeper and investigate them?
So what you want to do is delve into them and give context, triangulate them, but don't go too deep and spend too much time there. Come back out, next one, deep dive, next one, deep dive. As a target, try and, like I say, the rule of threes that I've always mentioned in my courses. Try and at least bat off 3 things and maybe a bit more if you've got time. Remember that you won't have enough time to do 10 different things. So I'd rather you didn't list 10 different things, but you've not explained anything. Because the marks aren't just about listing key issues, but also explaining it. Sorry?
I was going to say, do you know, because the question's about old people's health, isn't it? Well, could you not say because they are a different generation? For example, their lifestyle factors, with smoking, they would have done that a lot more and would have known the long-term effects.
Of course.
Wasn't it seen as a good thing for them then? and then obviously they've been doing it for so long, that's then got like detrimental.
Well, yeah, I mean, look, these folks have gone through so much. I mean, you wonder how they've survived to good old age, but they've actually gone through so much torment. With a lot of them have gone through wars.
Yeah.
And they've fought and they've done so much, and still they're here. So yeah, of course they're gonna so-called reap the consequences of that.
Yeah.
So war veterans going through PTSD. Suffering from hallucinations, struggling with their mental health. A lot of them had to grow up without family members around them because the war tore them apart. It's it's a tough upbringing they've had, and yeah, sadly, there's ill health consequences as a result.
Asbestos.
Asbestos. Yeah.
What's that?
Asbestos. They used to line roofs and ceilings with that kind of stuff because it was good for insulation. But then they discovered the stuff gave off little flakes of, microfiber-like things that went into your lungs, and they kind of cause cancer.
COPD and things like that, isn't it?
Yeah.
Could you also get thalidomide?
Thalidomide, I suppose, it depends what the context is. I think.
Like that question.
So in that question, I probably wouldn't bring up thalidomide because it didn't affect most elderly people. It was mainly women of childbearing age in the 50s and 60s who were given thalidomide and affected their babies. So you contextually probably wouldn't figure as much.
Okay.
The smoking scenario, isn't that like now the generation, isn't that maybe even getting worse with like vapes being accessible and nearly every underage person? But haven't they, I don't know if this is true, it might be another country actually. I don't know if it's Norway or I think England as well. So the people who are now 13, that generation from then on, cannot purchase cigarettes anymore.
It's the UK.
As
I think,
well.
I think King
UCAT
Charles
said that.
I know Norway implemented this. So it's like the generation, so like after us, they just can't. And like the UK has put quite a few things in like the tax, you have to pay extra.
Yeah, absolutely. There's a raft of rules and regulations now, but it's still too slack. It's still too slack. It's still too easy to get unregulated products out there. It's still easy to just go and buy things, and because there's dosage issues with vaping as well. So for example, somebody who could end up on the equivalent of 20 cigarette versus equivalent of nicotine on a vape, and they were probably on 1 or 2 cigarettes before that anyway. So if anything, you've actually made it worse. So there's some calls about it being dispensed through qualified outlets rather than any old shop out there. So at the moment there isn't that level of regulation. They're trying to introduce that. They may introduce a system where they ban it for purchase by under 16s. So they're looking at options of trying to, curtail vaping. It's a big issue right now.
Yeah, I feel like it's bigger than ever. Like the underage people, such as teenagers, children, such as like starting from the age of 10 as well, just vaping, and it's accessible to everyone. I think it's like more. It's even customized towards a younger audience, whereas like cigarettes and smoking is maybe for older people, but a vape flavored bubble gum, like Fanta or something like that, like it would be more targeted towards younger, appealing.
And the packaging as well was like
pink.
Looks like a toy, doesn't it?
Yeah, none of us have any idea what the actual long-term effects of it are either, which is scary.
Yeah, you don't know what it's equivalent to because, like, again, vaping, you could be vaping the whole entire day in your bedroom and everything compared to like a cigarette.
So I think you guys have just discussed a hot topic.
Have we?
Yeah.
Oh, the cigarette vape. Would you think that could come on?
Very possible.
Yeah.
Vaping's been in the news for months now. So rather than a question on smoking, the risks of smoking, very easily it could be discuss vaping. What are the implications on a young population? And you've covered it very well. So whether I throw in vaping, whether it's nitrous oxide, that's been in the news, hasn't it?
Yeah, it has.
Right. Whether I throw in smoking, cannabis, heroin, you can deal with it if you have a framework. in mind, and follow this through, I think you guys will be okay.
So does the NOS, I mean, that's like the canisters, isn't it? Does that like, how does that, it's been paralysing people, hasn't it? Is that like to do with like, I heard it was something to do with sort of a vitamin or something, that it's like sort of like...
I don't understand enough of it. I don't think anybody quite understands how these things work. You know, you need big trials and controlled trials and things to really understand for sure how things work. But you find these people have all sorts of breathing problems, mental health problems. You know, what's the chemical process or the physiology behind it? I don't quite know. There probably is a bit more out there, but I certainly haven't researched it enough to know about things.
I think it's something to do with like the things surrounding nerves in your back, and then like, I don't know what it's called, like around your nerves you've got something, and the vitamin that makes that thing, it gets like stripped away by the NOS, like it could be something to do with that.
There are so many variations out of it on the streets. How would they know which one to test and which one actually?
That's what I mean. How do they? What I was wondering is, how do they actually test drugs like this? Because who's going to want to take them if they know they're dangerous? I guess people are already addicted to them, but they wouldn't.
A lot of people aren't taking drugs because they're aware of the dangers. They're not. It's peer pressure. It's a cool thing to do.
Yeah, especially this generation.
Yeah, that's what drives it. Well, I mean, generation. You can argue if you look at my generation, a lot of these guys smoked not because they knew or thought about side effects and risks. Everybody smoked. It was a friend thing, you know. Kids might, you know, people might call them kids. People I grew up with, smoking was the main thing. And then other things like cannabis on the side. Those were your main street drugs out there. And you did it because other people are doing it. And you never really thought of it. And I think the same goes for the newer generation. They're not really thinking about side effects and things, because the other thing is, when you're young, you don't think about death and things like that, do you, as much? It's a far away thing. It's a distant thing. So even if I knew that, smoking can damage your lungs and cause lung cancer, well, I'm only 16. You know, surely that's a long way away for me to worry about. You know what I mean? I'm just having a few drags with my friends. So surely that's okay.
Especially when it comes to addiction, though, like when you know, maybe on that one occasion that you smoking, that might not lead to your you getting lung cancer, but over the course of many years, because essentially you're getting addicted to that substance. I mean, no smoker, I assume, goes in and has a cigarette and thinks,
no,
well, this is the day that I'm going to be addicted. Like, you never go in and say, I'm starting being a smoker from this day forward.
No.
I assume that it's just like you're going in and it just develops as something. They never meant for it to become this big of a problem, but then it is.
Yeah, absolutely. Exactly. Nobody thinks like that, you know, but unfortunately we end up there. Who wants to have who wants to have got a question?
This has been recording for like 17 minutes.
Oh, really? Oh my God, I thought you'd stopped it. Who wants to have